MEDITECH empowers healthcare organizations around the globe to expand their vision of what's possible with Expanse, the intelligent EHR platform. Expanse answers the demands of an overburdened workforce with personalized workflows, interoperable systems, and innovative AI applications, all working together to drive better patient outcomes. Discover why healthcare organizations of all types and sizes choose Expanse to meet the challenges of the new era in healthcare. Visit ehr.meditech.com to learn more. Today on Town Hall.
So now when you go into a doctor's office, they've got the capability of seeing everything that's happened with you. And they can even customize what they want to see. So maybe they only want to see the last labs. Okay, I've got those. But what if they want to see the last 5 years of labs? They can see those trended, graphed out.
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Town Hall show is designed to bring insights from practitioners and leaders on the front lines of healthcare. All right, let's jump right into today's episode. All right, welcome to Town Hall. And today we have a special guest. We have Jim Matney, President and CEO of Colquitt Regional Medical Center. Jim, welcome to the show.
Thanks, Bill. I look forward to talking to you about.
So this is your first podcast ever that you've been
First
on?
podcast ever.
Wow. And it's quite the honor. Well, tell us a little bit about Colquitt Regional.
Well, we just recently came to a name change, which is Colquitt Regional Health System, because we felt like Colquitt Regional Medical Center was more just a hospital, but we're kind of more than just a hospital. We have 3 residencies. We have a family medicine residency, we have a psych residency, and we have a general surgery residency. And we're getting ready to start a OB residency. All that in a 99-bed hospital, you can imagine. We live in rural Georgia, a place called Moultrie, Georgia. And when I first got here, our biggest struggle was trying to recruit physicians. And we're not successful because if people have a chance to live in Atlanta or live in a place where there's more restaurants, they tend to choose that. So I decided to build my own. So we started what we call the Georgia South residency. And it started out like a rural track where and I think you interviewed Scott Steiner at CD once. So we became part of their residency. And then as we continued to grow, we kind of went independent on our own. So we just started our residency programs. And then from that, we started home care, hospice, and then we just bought a nursing home. And then we bought a rehabilitation center. So, and all that in the kind of the boundaries of Colquitt County. So we recently have increased our bed size back to 155 beds because we have 99 beds, and like today, our census is 108. So
you really are the hub of care for that region. I mean, from birth to aging.
It started out in 2011. Our average daily census was 36, and now our average daily census is 103. We get 30% in migration from all the surrounding counties. And we're surrounded by bigger hospitals, 250 to 300 bed hospitals around us. But 30% of the people choose to come here for emergency room care, 29% come for OB care, and 30% come from outside, from the region for general surgery care too. So it's just amazing how we did it. And we did it with the MEDITECH platform. I mean, as we continue to grow, like our cancer service businesses, we started out with another software system, and then our cancer service got bigger. And the biggest complaint is how do I get that medical records? And we were able to pull in MEDITECH. We've kind of grown with them. It's been great because we've been able to take the EMR that we got and use it for all the different kind of companies we've got. We've got our Sterling physician. When I got here in 2011, we had 3 clinics, and now we've got close to 30.
Wow. So we hear a lot about the fact that rural healthcare organizations are struggling. You guys appear to be thriving, even growing through this. What do you attribute that to? I mean, where does that come from? Is it the flexibility to go where the community's asking? I mean, what do you ascribe that to?
Bill, and I know my colleagues won't like what I say, but how in the world can you not make a profit when you're full? When you're at capacity, and it was like during the COVID, you heard all these hospitals pour mouth about how hospitals are doing terrible, but the hospitals were full. And if it's a cost structure thing, so, and I'm an economic person by education too, that if you keep your costs steady, especially on a per unit basis, if that cost per unit stays consistent, then as you add more volume, you make more income. Now, we're not making tons of money, but we're able to reinvest back into our community. So since we're not a for-profit and we're not part of the system, like last year, we put $26 million of the 28 million that we made back into the hospital on new technology, like new CT scanners. We've added a PET scan. We've added radiation oncology. So basically, we look at the needs of our region and we add technology to that. We're one of the few hospitals that participate in the intuitive plan where we're teaching hospital, and we have 4 robots in our 6 surgery suites. So I think that the key is the fact that we listen to see what our needs are in our community, and we understand what we can and can't do, and we provide the latest and greatest technology with a customer service focus and a quality focus. One of the things that we're proud of is that for 19 times in a row, we've actually got an A on the Leapfrog patient safety score. We focus on quality, we focus on customer service, and we focus on technology.
Wow. So you've received.
Kind of answered the question. The difference between our rural hospital and another rural hospital is that we don't let the ruralness define us. We make sure that when you're coming here for an MRI, you got a 3T MRI. When you're coming here for a CT scan, we have 2 128 slice CT scanners. When you're coming here for surgery, because a lot of people choose robotic surgery, we've got 4 intuitive robots in our OR suite so that people are getting the same care that they would get either in Atlanta or in Albany or in Moultrie, Georgia.
You've personally won a couple of awards, just want to call it. So Georgia Hospital Association 2023 W. Daniel Barker Leadership Award and Georgia Alliance of Community Hospital CEO of the Year Award. Congratulations on that, by the way.
Thank you.
Talk to me a little bit about the patient safety priority and the work that you've done in patient safety. This is one of the things that's a concern is you go to Atlanta, you can receive better care than you can in rural Georgia. That's one of the concerns that we have as we have this physician shortage. It looks like you started with the residency program and bringing in high quality residents, and then you essentially layer on that the investing back into the technology and the things that they need to be successful.
Well, it's kind of been a journey. Like, for example, when we started out in 2011, we wanted a residency program. Well, to get a residency program, you got to have medical students. So we approached the Philadelphia College of Osteopathic Medicine and convinced them to open up a medical school, a 4-year medical school right here in Moultrie. And so that's been a great partnership. You think about those awards I won, it was because we really transformed this whole community to where we've got a 47,000 population, but we've got a 4-year medical school right here in Moultrie. And those medical students fed into our residency, which the residency fed into physicians on our staff. And by doing it from the start, so you get your 3rd-year residents, and you're talking about quality, you're talking about customer satisfaction, and you kind of get down and you grow them with the culture of the organization. Quality, for example, we just won another award that we're getting next month where we won the GHA Patient Safety Award in the whole state for our work that we've done on sepsis. So one of the things that we talked about with sepsis is the fact that there is clear criteria what you need to do when somebody is septic. There's 4 different criteria in there. So we hardwired that into our system to where literally when somebody comes in, you're checking the blood cultures. You're checking to make sure that the fluids are given at the right time, then you're checking to make sure that you're going back and doing another blood culture and that you're delivering the right antibiotic to that patient. Because when a patient is septic, they've got some type of infection going on. So a lot of people will just throw different antibiotics at them. But if we can get that blood culture done at the time when they're in that emergency room, then we can find out what that infection, what antibiotic will react to it. And if we get that timely within an hour, then we can deliver the right care. Versus, and you talked about Atlanta. Okay, if you go, and the other thing is we hardwired our emergency room. So our average wait time is 22 minutes from the time you walk in to you see a provider. But before you even see a provider, at the triage desk, that nurse is already ordering the labs, she's ordering the x-rays, so that when the patient does see the doctor, they've gotten all the results there. And that's what we've been able to do, is to get the flow going to where everything works perfectly. Versus if you go to Atlanta, you might stay in an emergency room for hours and hours. You hear about these long waits in these emergency rooms. Well, our average patient waits 22 minutes.
Yeah, till they're sitting. I'd love to. We spend a lot of time talking about the intersection of technology and healthcare. You mentioned MEDITECH, and we were talking a little bit about this before we hit record on this show. I was with a MEDITECH shop, 16 hospital MEDITECH shop in Southern California, and you guys run MEDITECH. One of the things I appreciated about it was it runs a health system very efficiently. Like, it's a really good system. It's a really good platform to run a health system on, and it's incredibly efficient. I'm curious, tell us a little bit about your partnership with MEDITECH.
Well, and it's been a long partnership. I mean, like I worked years ago for 4 or 5 companies that had MEDITECH. So I knew that MEDITECH could be nimble. MEDITECH, you could move it and make it do what you wanted to do. If you think about a lot of EMRs, many EMRs, it's just, it's as good as how you create it. So I knew that MEDITECH had the kind of the ability to do it. So with what we've done with MEDITECH is like for our physicians, all of our physicians are on MEDITECH. Well, we also put our home care on MEDITECH, and we put our hospice on MEDITECH. We put our rehab on MEDITECH. We put our cancer on MEDITECH. So now when you go into a doctor's office, they've got the capability of seeing everything that's happened with you. And they can even customize what they want to see. So maybe they only want to see the last labs. Okay, I've got those. But what if they want to see the last 5 years of labs? They can see those trended, graphed out. So the thing that I get excited about MEDITECH is, one, it's very efficient. But two, it's moldable. You can mold it the way you want it to happen. A lot of EMRs, they give you this and they say, this is what we can do. And you'll say, it can't do that. It can't do this. Well, with MEDITECH, we've been able to actually fix it the way we want it and customize it, not just at the system level, but the individual physician can customize it. And then if Dr. Sproul, for example, only wants to see certain things, well, he doesn't impact Dr. Jones over here, because Dr. Jones might be a rheumatologist that they just want to see certain things. So every single physician can customize it to what they want, but then I can pull all that together from a system standpoint and look at my quality, look at my revenue. I've got real-time revenue. I've got real-time quality results that I create a dashboard every day that gives me a dashboard of what do I need to see as a leader to make sure that our quality is good, our patient satisfaction is good, and our financial results.
Yeah, I mean, you talk about the customization. I remember, this is a weird story, but we had implemented MEDITECH, and one of the doctors kept complaining, and he just said, I hate this. It doesn't do what I want it to do. So we took one of our champions and we sent him down to work with him, and then he helped him to customize it. I remember going back down to him like 30 days. He was supposed to learn all that through training, but he didn't need the training, of course. But 30 days later, I went down to him. He's just like, it's amazing. It's like life-changing. And customizing this it's like changed my life. And it's like, yeah, I think sometimes people just limp along when, if they would just take that time and customize it, it becomes a tool that fits their workflow and their way of practicing.
That was a game changer for us, because when we went up to put the physicians on MEDITECH, just like any EMR change, you get a lot of complaints. Whenever you implemented a new EMR, everybody hated you. Well, we brought in one of those champions from MEDITECH too, which really worked to work with the docs to customize the EMR the way they want it. And I always check back with them and they tell us great. And the interesting data point, and I'm a big data point, is that we use Press-Ganey to do physician satisfaction score. One of the interesting things is, one of the questions is, do you like the EMR system that this health system is using? And we scored on the 73rd percentile nationwide, which is higher than the national average significantly, because you imagine the national average is 50. So that's the 50th percentile, that's the average.
Yeah.
We scored on the 73rd percentile of physician satisfaction with our EMR system. And it's primarily because of the fact that we have been able to customize.
Yeah. I remember talking to that doctor. I said to him, I'm like, do you have an iPhone? He said, yeah. I said, did you download some apps? He goes, oh, absolutely. I'm like, did you move them around? Did you put pictures on it? He goes, yeah. I'm like, so if I took that and restored it to its default, would you still like that phone? He goes, no. I'm like, well, that's what you've been using since we installed it, is the default. Now you have your version that helps you. I want to talk a little bit about health equity. Talk a little bit about health equity in rural communities like Colquitt that you guys serve.
Well, and that's the big requirement for CMS is that, and Joint Commission, is that people start the initiative to where they're asking people, do they have, and I guess the best example is a person with COPD, and you wonder why they might keep flipping back and being readmitted. Well, with health equities and with our system, we were able to build in 5 basic questions like, do you feel safe at home? Do you have money for food? Are you able to pay your rent? Are you able to keep utilities going? Well, we were able to build those into our questions that the nurses asked them, and then pinpoint what were some of the issues with health equity had. And we found out food showed up in every single category as a problem, that people tend to not buy their medications because they're purchasing food. Well, as a result of that data that we're able to get out of the questions, we started this food program with our foundation to where patients that are discharged, we send them home with food that weekend, with meals that we get donated, or we probably don't, so that we can take care of their food. And then what we found was those patients that we started on just one floor, and then we moved it to all the floors of the people that showed up as food as a problem. And that's where we were able to take some of the health equity questions and put it to action application. Another example is in our pediatric unit. We found that patients that come into our emergency room, lots of times the doctor would say, okay, you can go home and do Pedialyte over the next 3 days and your child is going to be fine. Well, Pedialyte costs, I think, somewhere around $7.25 each. Well, what we found is that those mothers don't have $21 for free servings of that. So looking at the health equity data, we figured out that there was some problems with food and drugs. So we were able to put those patients in the hospital, which increased our admissions, but we actually were able to give them better in one day by giving them fluids overnight. And that all came about because of the health equity data that showed pediatric families have a difficulty either paying rent or with food.
Yeah, it's seems like a logical approach to this. Did I hear you correctly that you have an economics degree? Is that what you have, or economics?
I got a minor in economics. I got my degree in business administration with the emphasis in accounting.
Wow, because it's interesting. My degree's in economics as well. I ended up in technology, but it's in economics. The great thing about economics, I think, is it teaches you how to solve complex problems.
It really does.
And it seems like you've solved a lot of really complex problems. I'm going to give you the last word on the episode. What haven't we covered? What's the question I haven't covered that you're kind of surprised that we haven't talked about?
I think the big question is the fact that the CEOs need to not delegate so much out that they're away from what the information's telling them. Probably the key to our success as a dashboard. And I would tell every CEO, create at least one dashboard of key areas that you really need to look at on a daily basis, a weekly basis, and a monthly basis. And have your quality data in one section, have your patient satisfaction in one section, and then have your key revenue and collection statistics in the other ones, and then have your volume over there in your other departments, because it's almost like spinning plates. You remember the old thing that the guy would get on and spin the plates? And if you go over and try to spin another plate, this other plate starts to go off track. Well, to me, the key to success as a leader is making sure all the plates are spinning. And the only way you can do that is build yourself just a dashboard. And the dashboard I've used for 40 years. It's got modified with quality and other stuff on it. And then you take 5 minutes a day out of your time to look and see where the areas are that you need to focus on. You might see that MRIs have slowed down. Well, why is the MRI slowing down? So you might need to call them. You might see that your Medicare length of stay is starting to creep up a little bit. So you might need to focus with case management. And having a dashboard that tells you cost, tells you revenue, tells you quality, and tells you patient satisfaction, to me is the key. I think the criticism I would have of some of my colleagues is they delegated this out to other vice presidents, and they're just not looking at it.
Yeah, I think the other thing I would mention is I've seen some of these dashboards and they're like 15 pages long. It's like
Mine's one page.
Yeah, it's got to be something that you could scan, see red, yellow, green, and go, "No, that's not right."
Well, I love your red, yellow, green, because my dashboard has the stoplight on it. And it's got red, yellow, green, and it's one page. And if something else needs to be added to that, I pull something off. For example, if we look at inductions prior to 39 and a half weeks, that we had that problem years ago. So I started tracking inductions for prior to 39 and a half weeks. And then we hit 0 inductions, and that was a quality indicator that everybody was looking at. We hit that for 5 years, so I took that off. And then I just look at it occasionally. CDIP, for example, we just finished COVID, the pandemic. So you had all these patients coming in, and we were throwing tons of antibiotics with them. So our CDIP, which is basically a symptom of taking too much antibiotics, started getting up. We had 17 cases in 1 year. We went from 2 to 17. Well, that wasn't on my radar until I looked at the end of the year. So then we started putting, okay, how many positive C. diffs are we seeing on a daily basis? And I track it daily now. And we went from that 17 high in 2022 to where this year we've had 1. So I think you're right, Bill. Don't build your spreadsheet too big to where you don't get a chance to look at it, but you really do need to modify what you're looking at almost on a monthly or every 2-month basis to keep the organization going.
And we'll close with this. Who's going to win the national championship this year?
Georgia Dog.
Georgia. That was too easy, I guess. But I could have given you who's going to win the SEC championship game, because I'm interviewing you before it, but it will probably air after it. So this could make you either sound really, really, really smart.
That has to do with Georgia Dogs. Now, how's Penn State doing this?
Well, Penn State has to play the #1 Oregon team this weekend for the Big Ten championship. And to be honest with you, I think that Penn State will win the Big Ten championship, but I do believe that Oregon will win the national championship.
If they win the national championship, they'd have to play Georgia, wouldn't it?
Well, not with 8 teams. I think isn't it 8 teams this year for the championship?
I think, I'm not sure.
Yeah, I'm curious to watch this new playoff and see how it plays out, but it will be an exciting couple of weeks of college football for sure. Jim, I want to thank you for your time. I want to thank you for the great work that you're doing in rural healthcare and in Georgia.
The one thing I would tell everybody is that I frequently get on calls for MEDITECH or something like that. if you really are considering an EMR system, and whether it's MEDITECH or not, talk to somebody and get the pros and cons and get the thing. And I'm always available to take a call from somebody that says, hey, I'm looking at MEDITECH. Can you tell me the pros and cons of it? Because yes, do I think some of these systems have a lot more bells and whistles? They do, but it's kind of back to your 15-page dashboard. How much of that can you really use? And that's the good thing to me about MEDITECH. And I was talking to somebody the other day about it. I said, the implementation's easier, the cost structure, the annual cost and the back cost is just, it's significant.
Yeah, I agree.
Always available for a phone call.
Sounds good. Thank you again for your time. Really appreciate it.
Thanks.
Thanks for listening to this week's Town Hall. A big thanks to our hosts and content creators. We really couldn't do it without them. We hope that you're going to share this podcast with a peer or a friend. It's a great chance to discuss and even establish a mentoring relationship along the way. One way you can support the show is to subscribe and leave us a rating. That would be really appreciated. Thanks for listening. That's all for now.